Hello, and welcome to another weekly webinar here with Sarah Flack, the Education Coordinator for the Child Advocacy Center of the Finger Lakes. Today, I'm going to be talking about the ACES study. For many of you, you may be familiar with the ACES study and the findings of it, but for some of you, you may not, so I'm just going to cover some of the basics. So what is ACES? ACES actually stands for the Adverse Childhood Experiences Study. It was originally initiated in 1995 as an obesity study, but what was found was that the majority of the participants were also victims of child sexual abuse, and we were starting to make some connections between some of the traumatic experiences that occur during childhood and how they impact life into adolescence and adulthood. The CDC and Kaiser Permanente were the people who conducted the research of over 17,000 participants. And here's what they found. They were starting to realize from the survey that childhood maltreatment and experiences would lead to later life health outcomes and a decreased well-being. So how did the CDC use the ACES study? So what the CDC was looking at was the experiences in childhood are major risk factors for poor quality of life, illness, and death later on. They also wanted to be able to understand the consequences of ACEs in later life so that they would be able to improve prevention measures and also work on ways to help youth and adolescents recover and improve their health outcomes regardless of their ACEs score. So now I'm going to look at some of the effects. As a child experiences some adverse childhood experiences, it's going to impair them in a variety of ways later on in life. The adverse childhood experiences have a strong and cumulative impact on the health and functioning of adults. Children who are abused or neglected are at a higher risk for health and social problems as adults. The toxic levels of stress or trauma experienced by a child is linked to poor physical and mental health throughout life. These problems include lower educational achievement, lower economic success, impaired social success in adulthood, alcoholism, depression, drug use, eating disorders, obesity, high-risk sexual behaviors, smoking, suicide, and certain chronic diseases. As you can see in this chart, there are several other things that we were making some connections with. These are just some and not an all-inclusive list by any means. Outcomes that may be more likely if a child scores higher in their ACEs test. And I'm going to kind of look at some of these questions to give you a better understanding of what are ACEs, what are these traumatic experiences that we're talking about that could occur during childhood that would lead to any of these variety of health and social outcomes. So what's your ACEs score? Some of you may have taken an ACEs test at some point in your life. I'm not going to put up all of the questions, but I am going to read through them. So essentially the ACEs quiz is really only 10 questions, and you would score yourself or answer the questions either yes or no. So if you've experienced this in your childhood, so before you were the age of 18, you would mark yourself yes and give yourself 1 point. If you say no, that would count as a score of 0. So question 1 is, did a parent or other adult in the household often or very often swear at you, insult you, put you down, or humiliate you, or act in a way that made you afraid that you might be physically hurt? If you can answer yes to this question, you would give yourself a 1. Question 2, did a parent or other adult in the household often or very often push, grab, slap, or throw something at you, or ever hit you so hard that you had marks or were injured? Again, if you can answer this yes, you would give yourself a 1. Question 3, did an adult or person at least 5 years older than you ever touch or fondle you or have you touch their body in a sexual way? or attempt or actually have oral, anal, or vaginal intercourse with you? Question 4. Did you often or very often feel that no one in your family loved you or thought you were important or special? Or your family didn't look out for each other, feel close to each other, or support each other? Question 5. Did you often or very often feel that you didn't have enough to eat, had to wear dirty clothes, and had no one to protect you? Or your parents were too drunk or high to take care of you or to take you to the doctor if needed? Question 6. Was a biological parent ever lost to you through divorce, abandonment, or other reason? Question 7. Was your mother or stepmother often or very often pushed, grabbed, slapped, or had something thrown at her, or sometimes often or very often kicked, bitten, hit with a fist, or hit with something hard, or ever repeatedly hit over at least a few minutes or threatened with a gun or knife? Question 8. Did you live with anyone who was a problem drinker or alcoholic or who used street drugs? Question 9. Was a household member depressed or mentally ill, or did a household member attempt suicide? Question 10. Did a household member go to prison? So after answering yes or no, for every yes that you responded to those 10 questions, you would score yourself with a 1 to get your total ACEs score. The connection that we were starting to make was that as the number of ACEs scores increased, so did the likelihood of many chronic health conditions, as well as the correlation between a low life potential, early death, or an increased amount of risky health behaviors. Many people have somewhere between 0 to 2 ACEs. When we hit 4 or more, we start to see an even more dramatic increase. So as an ACE score reaches 4, the lung disease increases in likelihood by 390%. Hepatitis likelihood increases by 240%. Depression likelihood increases by 460%. And suicide likelihood increases by over 1,200%. As we started finding out all of these correlations between early childhood adverse experiences and the correlation to later life functioning and well-being, the CDC really wanted to put a strong emphasis on prevention. They've outlined 6 different prevention strategies. The first is to strengthen the economic supports to families. So this could include strengthening household financial security as well as family-friendly work policies. So encouraging employers to really consider their policies that would make it more family-friendly and child-friendly for their employees. They also wanted to put a strong focus on promoting social norms that protect against violence and adversity. We do this a lot of times through public education campaigns, bystander approaches, including men and boys as allies in prevention, and also through legislative approaches to reduce corporal punishment. Their third prevention strategy was to ensure a strong start for children, which includes early childhood home visitation, high quality childcare, preschool enrichment with family engagement. So really starting kids off with some strong connections outside of the home that also are strong connections for the parents as well. The fourth strategy is to teach children and families skills. So we really put a strong focus on social emotional learning. As our youth grow into adolescence, talking to them about safe dates and healthy relationship skills. And then for our adults, working on parenting skills and family relationship programs. The fifth stage is to connect youth to caring adults and activities, whether that's through mentoring programs, extracurriculars, youth sports, or after-school programs. They all play vital roles to both our youth and to their parents and caretakers. The final prevention strategy is to intervene to lessen immediate and long-term harms. This would include enhanced primary care, victim-centered services, treatments to lessen the harm of ACEs, treatment to prevent problematic behavior and future involvement in violence, as well as family-centered treatment for substance abuse disorders. To learn more about the ACES study and what we can do to help prevent adverse childhood experiences, I would encourage you to go to one of these following websites. There's the American SPCC, as well as the cdc.gov website, and this is the direct link. However, you can simply type it in a Google search and it should come right up. If you have any further questions or would like to schedule a training that's more comprehensive about the ACEs study and what you can do to help work through some of these adverse childhood experiences with your youth and clients, please feel free to reach out to me. My email address is sarah@cacfingerlakes.org,